What do you do? It's such a common question, but it always makes me pause. I'm a veterinarian, I say. Simple, right? What's the big deal? After all, it's not like admitting you're a lawyer and bracing yourself for a potential onslaught of bad lawyer jokes. In reality, the usual response I hear is favorable, complimentary even. Oh, that's so cool. I love my vet. Right away, the person is thinking about their beloved mixed-breed dog, adopted from the Humane Society, or their foot-warming, purring kitty cat. Or perhaps your mind jumps to a chapter from James Herriot's All Creatures Great and Small, the quintessential reading for anyone who's thinking about a career in veterinary medicine, or so my 7th grade English teacher tried to tell me. I realized recently that I've been a veterinarian for 16 years, and I had actually never read a single book by James Herriot. Terrible, sacrilegious even. So I did. I sat down and started to read exactly what the title promises. Quote, The Warm and Joyful Memoirs of an Animal Doctor. James Herriot is the pen name of Dr. White, a country animal doctor who practiced in the picturesque English countryside of the Yorkshire Dales in the 1930s, 40s, and 50s. He used his many years of experiences to write stories, but this wasn't just a collection of great stories. It was, in my opinion, actually pretty horrific reading. An accurate reflection of the state of veterinary medicine over 50 years ago? To be sure. Entertaining? Without a doubt. But if I had read chapter 1 when I was in my early teens, I doubt I would have ever become a veterinarian. It describes in graphic detail the 2-hour Herculean effort Herriot expended while stripped to the waist in the middle of a bitter cold winter night, laying face down on a barn floor in a pool of nameless muck, his arm deep inside a straining cow, trying to help her successfully deliver a calf. Thanks, but no thanks. There's been a large-scale shift over the course of the 20th century. At its start, virtually all of a veterinarian's time was spent working with large animals, horses, cattle, sheep, pigs. By the year 2000, the majority of veterinarians practiced mostly on companion animals belonging to people who could afford and had the leisure time to keep animals merely for pleasure. And still many people do not realize that veterinary medicine has evolved to the point of specialization. Sometimes, for some of us, 8 years of undergraduate and veterinary medical school isn't enough. We elect to pursue another 3 to 5 years of long hours and low pay and internship and residency training. So back to the getting to know you conversation. The next question typically is, so where do you practice? And when I say at the University of Missouri, I see a puzzled look. So do you teach, or do you see patients, or how does that work exactly? Well, I say actually I do both, but I'm a specialist in ophthalmology. I teach only about and work only on eyes. As long as it's a species with an eyeball problem, I'm all over it. The idea of performing cataract surgery on a miniature foal seems to some unreal, but here are 2 of my former residents doing just that. I go on trying to explain. It's like medical school, but for animals. We have veterinary cardiologists, oncologists, radiologists, orthopedic surgeons, neurologists, internists, criticalists, and many other specialists. I was introduced to the dean of the University of Missouri's School of a few years ago. And upon learning that I was a veterinary ophthalmologist, he laughed out loud and he said, "So how do you check if a dog can see?" And then he covered his eye and he said, "Woof, woof." It's okay, I thought. All deans have their idiotic moments, right? Okay, so I'm not the one you want to call if your Holstein needs a pregnancy check. I'm the one you want to come and see when your beloved family dog goes suddenly blind from cataracts. It is an incredible feeling to watch a frightened dog come into your exam room one day, totally unable to see, be able to locate their owners across the room the very next after performing successful cataract surgery. Happy ending. Unfortunately, not always. This was a young foal who ran through a barbed wire fence and tore off his entire eyelids. What impressed me most about this case was the referral veterinarian's unwavering dedication. She rescued the foal's eyelids off the fence, stuffed them in a bag of ice, loaded up the mare and foal, and personally drove them all the way to our teaching hospital with the hopes that we might be able to do something. Unfortunately, I would have needed superpowers to fix this particular problem. Sometimes the problem isn't too little, but too much. So much excessive eyelid tissue, it completely obscures the patient's vision, so we can nip and tuck, and sometimes we may even feel the urge to use a facelift technique that originates back by the anus to smooth out the dog's wrinkles, the so-called going to the dentist Hollywood special, as it were. Cancer can affect the eye or eyelids, like this example of squamous cell carcinoma. Here's the problem. Horses don't have a lot of extra eyelid skin that can be safely cut out and still remain functional. The skin on their face is so tightly adhered to the underlying bone that most skin grafting procedures are impossible. And if we can't preserve normal eyelid function, we will never be able to save the eye. Necessity can be the mother of invention. This is Dixie. She had been suffering with eyelid cancer for 10 months before I met her and had already undergone 5 different treatments. I remember reading over a medical record and thinking, I'm going to have to tell this owner I can't save this eye. This cancer is just too aggressive. It can't be done. Or could it? One very special horse and owner, one crazy idea, one last-ditch effort, one success story can help you see a problem in a new light. A few more years' experience, some research, several more affected horses owned by hopeful clients willing to put their faith in me, I discovered something new. Using a combination of a photoactive agent and a specific laser energy, I developed a way to use something called photodynamic therapy to successfully treat horses with eyelid cancer. Seeing is believing had just taken on a whole new meaning for me and Dixie. Here's a composite of my first years of horses treated with this novel therapy in veterinary ophthalmology. Years after just one treatment, still able to blink, no eyelid cancer recurrences, still fully sighted and functional horses. So, is it being able to practice within the walls of an ivory tower really where it's at? After all, translational research with applicability to people as well as animals are today's buzzwords on any grant application. But is what we do so very different than those stories set in a rural, rustic reality so graphically recounted by James Herriot several decades ago? Yes and no. Animals are central to our lives as veterinarians and to many of the advancements made in physician medicine. Yet it was Herriot's shrewd observations of persons, animals, and their close interrelationship that gave his writing so much of its distinct character and truly embodies the meaning of what it is to be a veterinarian. His writing is, at its root, an amiable but keen comment on the human condition. Helen Keller once said, "The only thing worse than being blind is having sight but no vision." I am ever so grateful to my patients and their owners for my 2020 vision moment in time. It is through their eyes that I have come to see new possibilities for novel therapeutic strategies. So I say to all creatures great and small, thank you for helping me to see a more bright and beautiful future.